Our overall goal is based upon a need that we perceive as significant among our members, and that is the rapidly changing dental benefits marketplace is much more difficult for them to navigate than in the past. Dental benefits have become more confusing for some. The marketplace is creating economic pressures that some of our members are having trouble with. And so our goal was to help them understand what's happening in the marketplace and to help them gain a knowledge base that they could use to make individual decisions. We basically divided practices up into 4 different models based upon the relationship with contracted insurance and showed them how certain aspects of their business would change depending upon what model they were in. Model 1, which I still believe is the most common model, would be about 1/3 contracted insurance and 2/3 either cash-paying patients or patients that have insurance that the practice is not contracted with. Model 2 would be 2/3 managed care, so we have 2/3 of the patient base is there via contracted insurance, 1/3 is cash indemnity. Model 3 would be 75% or more contracted insurance, and that could include capitation, sometimes called HMO plans. Model 4 is the least common in the marketplace, the least level of prevalence, and that would be insurance independent practices that have no contracted insurance at all. All the patients have a cash indemnity relationship with the office.
I'm Dr. Gary Dougan, and I'm the National Dental Director for Liberty Dental Plan. Common errors that dentists make are very simple errors, things like not filling out the claim form correctly or completely, making careless errors in some of the narrative statements and some of the attachments, not understanding the current codes for the procedures being done and how those codes should be reported and what supplemental materials should be presented with those codes. Since codes do change annually now, it's a real challenge for dental office staff and dentists to be up on all the latest code changes. But that can make a big difference in your success, is knowing what current codes are changing out there.
I'm Dr. Charles Stewart. I have a practice in Agoura Hills, California. I am the Regional Dental Director for Aetna Dental of California and also for Aetna Dental National. Smoke and mirrors in dentistry is basically talking about dental fraud or aberrations in billing. Make sure that all the claims that are leaving your office are accurate and reflect the services that were actually rendered, because even though your staff may be performing and issuing those claims and making those claims, it is your name, your license number, and your reputation that's on the line with every claim that leaves your office.